Welcome back to our third video where we will be working on Gen's sciatic nerve to see if there's some compression that's taking place from his most recent ankle injury in September? September, okay. So far we have actually been able to do some work on his ankle, his calves, his hamstrings, and we've led up into the hips. So today we're actually going to get to the meat of what is going on here to find out exactly what is going on with the glute complex. Inside of here, what a lot of people don't know is you have a muscle that is called the piriformis. The piriformis is the muscle that compresses on the sciatic nerve. The sciatic nerve starts at the low back. It's the longest nerve in the body. It makes its way down. And that is why a lot of times the symptoms of burning and tingling from the low back down into the feet take place. The sciatic nerve cuts right through here. It's right in the middle of the glutes, but it is very, 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 very deep into the glute complex. There are three sets of muscles in the glutes. You have your gluteus maximus, your gluteus medius, and your gluteus minimus. And somewhere along that complex, you have the piriformis that crosses over the sciatic nerve. So when you have tightness in the glutes, you now have nerve compression, you now have pain. Everybody wants a tight butt till you're in pain, right? Okay, so we're going to check on Gen's now, and we're going to see exactly if this piriformis is tightened up and is causing him these issues. You ready, Jens? All right, sweet. So what I'm going to do now is I'm going to just kind of do some compressions around the hip, low back, sacral area to kind of see where he's feeling tenderness, okay? Here?
Yep.
Okay. Take a deep breath in. Exhale. See, at this point you just kind of hold. And what I usually do is, with the glutes, you can kind of move around a little so you can sift through the muscles. They're very, very thick muscles. So you can actually sift through the fibers and you can cause a release to happen a lot faster. How's that feel?
Good.
Good? Another thing with the glutes that is also great is, as a therapist, with the therapy I provide, I'm able to move around different areas with the same pressure, following Gen's breath. As he inhales and he exhales, I always wait until his exhale to relocate and go somewhere else that I feel may need attention or that's tight. Gen's, how we doing?
Good.
Up through here? Okay. Deep breath in. Exhale. Right now what I'm feeling, Jens is experiencing tightness in his lumbosacral area. It's where his low back and his sacrum meet. A lot of patients have that with back problems, and sometimes we need to know the difference between what is back pain and what is sciatica, because sciatica travels and back pain doesn't. It's local. You doing okay?
I feel that in my little toe.
It's traveling. Jens, how we feeling?
Good.
Good? Alright, we'll shift over.
Oh.
Now we're getting deeper. Alright, I'm gonna have to readjust here just a little bit.
Oh.
Here we go. How's that feel? Okay. I mean, that's fair. You know, no answer is better than an insult. And that does happen. I get insults. But I also get hugs after the session's over, so all's forgiven. Felt a release? Good deal. I did too. Alright. Okay, so what happens is I've started to release our top portion. How are we feeling up there?
Good, it's tender, but that's good.
Definitely tender because it was tight when I started, so therefore since it's tender, it's because I worked a really tight area. An hour on the table is equivalent to 2 on the gym. Any muscle work that is done is just like you wouldn't lift weights and you're feeling it the same day. Alright, Jens, so what's next is, usually when you want to hit the piriformis to find out exactly if that is what is causing sciatica, even though Jens has already stated that the pain or the feeling that he felt traveled down to his pinky, I usually try to hit the sciatica. I hit the hip complex in 4 different places with extreme pressure, and I hold it. And we go above, to the side, below, and then I strip down the middle of the glute. Those are the 4 that I do to help relieve piriformis compression on the sciatic nerve. Okay? So I will start up top, where I began to warm Jens up. How we feeling?
Good.
All right, now I'm going to do a hold here, okay? Deep breath in, exhale. Right. So now I'm covering a larger portion of the top of the hip complex when I stand up and I do this, because the 4 areas that I cover are going to cover the entire hip. Nice. Sweet. Alright, there's the top part. Then I usually make it down here again, but I keep the legs straight this time. Alright? Jens, how you feeling?
Good.
You good? Alright, we can get some pressure going. Deep breath in. Exhale. Nice. Now, as I do this, what I'm also doing is I'm helping to increase the range of motion in his hips. So that'll help with his hip rotation. Jens, you doing okay? Good deal. Sound like you're falling asleep over there.
I'm focusing on my breathing.
Gotcha. When that happens, that usually means that there's some discomfort, which is, it's normal. It's totally normal. All right, buddy, I'm about to release. Take a deep breath in. Exhale. Nice, nice. Okay, so we're gonna hit the side now. This is usually where the rubber meets the road. Jens, are you ready for this?
I'm ready.
All right, buddy. So I head in from the side, find the side bone, go up just a tad. Once you're ready, on the count of 3, breathe in. 1, 2, 3. Yeah, this one's rough. Great breathing. On a scale of 1 to 10, what's your pain?
6.
6. Not bad. Let me know as it changes.
5. 4. 3. 2. 1.
Nice. 7's our magic number. Alright, so last one I do is I strip down the middle. Now, Jens, during that, did you feel anything else traveling down the leg?
Honestly, I was focusing on my breathing so much I wasn't paying attention.
Okay, okay. So, what I usually do here is, because we have 2 different hips, we have our sacrum that lines down through here. Right around this area gets really tight. Right around here. So what I usually do is I start right where the sacrum goes down, and I'll curve my elbow into there, into a groove. 1, 2, 3. Alright, now I'm there. I have not applied the pressure yet. I have just now only positioned myself. Jens, I want you to take a deep breath in. Exhale. And then I strip. Now what I do is I'm not going to lift up until I am all the way down in Jen's hamstrings. I'm going to go straight down this area with the same pressure. As it releases, I'm going to move down just a little bit more. during this process, you have to follow your patient's breathing. It has to be completely normal before you can move on. Alright. Usually you'll know the breath will almost become shallow. If you hear your patient breathing in through the nose and out through the mouth, give them time to acclimate. Once you hear a shallow breath as if it's normal and nothing is going on, then it's okay to go ahead and move on, because that next area may be twice as painful or twice as much discomfort, and they need time to acclimate. So give them time in between to breathe normally before you move on. You doing okay?
Yeah.
All right, we're gonna shift down now, okay?
All right.
Deep breath in. Exhale. And probably move down maybe 1/4 of an inch. James, how you feeling?
All right.
Anything traveling anywhere?
Yeah, it's all first 3 toes of my left foot.
Okay. Alright. Okay. You move down a little bit more now, okay? Alright. Deep inhale. Exhale. Whoa. You got through that one kind of quick. So what happened was Jen's actually let out so much oxygen that 2 releases took place and my elbow shifted down further than I anticipated. I'm at a whole new spot. Jens, how you feeling?
Good.
Okay. Alright. Let's shift down a little bit more now. We're almost to the hamstrings. And this right here is where it gets really tight.
Yeah.
Yeah. This is usually the tightest portion, and that's why I don't say I save the best for last. I just try to loosen up everything around the area. You don't go to the tightest area and work on that first. You loosen everything up around the area in hopes that the central problem is then loosened up enough to work on effectively. Jens, how we doing?
It's tight.
Keep breathing. There's a lot of spasms going on. Alright, we do a little shift. I feel something here.
Oh.
Yeah. So now it's a whole different angle over in here. Exactly. There we go. Keep breathing. There's another one. How we feeling?
Good.
Alright.
Yep.
Okay, so this is what I want you to do. I want you to sit up and turn around and sit on the table for me. How we feeling? Take your time. I don't want you to stand up yet. Definitely a circulation shift, so you never want to jump off the table.
Yeah, that's I'm feeling like a lot of blood flows just kind of going around, so that's
It's kind of overwhelming.
yeah, it's
isn't it?
kind of like catching your bearings.
Absolutely.
Yeah.
After every massage session, especially when you're dealing with pain management, there is so much circulation going on. You always want to let patients know, and I always tell my patients, do me a favor, take your time getting up off of the table, because so much circulation goes on, you have accidents. People hop up so fast trying to get dressed and they get lightheaded. Like if you jump out of bed too fast in the morning before your blood circulates, same idea. But the only thing with massage is there's way more circulation going on than just waking up in the morning. So, you know, to avoid accidents, people feeling light, faint, nauseous, and things of that nature, take your time, gather your bearings, breathe, and drink some water. You know what I mean? So, do me another favor. Stand up. How you feel?
Good. I feel fantastic.
Is there anything that you're experiencing different or less of that you did before?
Yeah. So you don't really notice it like when I live with it all the time.
Right.
But there's like it was a constant like tightness and pressure and just things like felt like they were kind of would spasm or have knots in it. Now it's just it feels so tender, loose, and tenderized that it's I don't know, I feel great.
Absolutely. Yeah. Usually most people say that I feel like a noodle.
Mm-hmm.
You know what I mean? So, okay. Well, that sounds good. And of course with that, you'll want plenty of water. If you experience any tenderness, anything of that nature, you can utilize a hot tub, sauna, whatever works for you. Okay. But also, that kind of comes with the territory. You know, you don't want to baby it. You want to use that range of motion, and you want to keep it. You know, so use it or lose it process.
Awesome.
So it's good working with you, Jens.
All right.
And
Thanks,
we'll
Geno.
we'll look at that hip again soon.
I hope so.
This is Geno and Dean Ryan working with Jens, and we'll see you soon.